everyone, welcome to this special edition of RichesTalk, where we dive into the journey and insights of remarkable individuals and entrepreneurs who have achieved tremendous success in their field. And today we have the privilege of speaking with Dr. Hong Chang, a distinguished figure in the dental industry and a visionary entrepreneur. So Dr. Hong Chang is a chief clinical director and founding partner of Experteeth Dental Group, a leading dental service provider with over 34 clinics across New South Wales, Victoria, Queensland, and Tasmania. Under Dr. Chang's leadership, Experteeth has grown rapidly since its establishment in 2017, expanding its footprint and services to becoming one of Australia's largest private dental group. So welcome, Dr. Hong Chang.
Hello, everyone.
So you started at Experteeth Dental Group with a single chair clinic in Chatswood, and now it has grown over 34 clinics across multiple states. So what made you start this journey from an employee to now a boss?
Well, I guess for all the dentists in Australia, we all have a dream to have our own practice, and that's a common sort of goal when we were students. Back then, we have 80 students in our cohort, and everybody wants to have a practice. But everybody wants to be a good dentist, but my goal is not to be a good dentist. My goal is always I want to have multiple clinics, and I wanted to service the fellow dentists so that they can service the patients. That's my goal when I was a student. I guess that inspiration comes from my dad, because my dad is a businessman, and I'm not from a medical or dental background family, so I think that definitely made a great impact.
My father is also a businessman, he does Chinese herb, traditional medicine.
Yeah.
But I did nothing related to medication. I built my insurance business, and now the Riches Review, the media. But I think the entrepreneur, they always start with a dream in their heart, like a burning fire, a burning desire. So you would, relate that to your father's business. So you saw how he worked hard for the business, for the family.
Because I think as a dentist, like we only have 24 hours of life in a day, and I can only work for 8 hours or 10 hours if I do have to work to death, right? And I can only see maybe 10 patients, maximum 20 patients, and there's a limited impact that can be placed in these communities through that. So whereas running a business, you can make a much greater impact, and you can help a lot more people. There's a famous person in China, Sun Yixan, Sun Zhongshan. Yeah, he was a doctor before.
He was a doctor.
And then he decided to pursue politics. And the reason why he wanted to pursue politics is precisely that reason, because he thinks he wants to help people at a greater scale. So I think that's what I wanted to do.
So instead of you want to have saying you want to have multiple clinics, but behind that is actually your desire to help more people, including more dentists and more patients, and even to pay more tax to the government.
Probably not the last part. But one thing that we notice in our society, or especially in dentistry, is that there's a great disparity between regional and metropolitan areas. The metro areas like Sydney and Melbourne is very well serviced by specialists, by medical professionals, whereas people in regional, they have limited choice. And people in regional, they really need the service of medical, whether it be dental, medical, that kind of service. That part is really lacking, and you can see that from our clinic profile. Over 2/3 of our clinics is actually located in regional. So that's something that we wanted to do as well, to enable the dentist to go to regional community, to serve the regional people. And also, it'll benefit the dentists as well, because they get to experience a different lifestyle, a whole different feeling.
And so the underlying principle for business is to satisfy needs of the people.
Yes,
and to find ways to scale that.
Well, the people say businessmen don't produce value, and I don't agree with that. I think for any business to be successful, value will have to be added throughout the process. Like for example, when you think about Apple, right? Steve Jobs, he invented iPhone, but why is he entitled to his wealth and success during that invention? Like he's like a very successful businessman. He's a billionaire, right? And the wealth that he has created to himself is actually only a small portion of the wealth that he created through the invention of iPhone.
Absolutely.
So for every single business person that is successful, you have to be able to deliver a product, or you have to be able to deliver a service that's beneficial to the society. And your success, what you're entitled to, is actually a very small portion of that change.
Absolutely. There is also a motivator that I really like called Zig Ziglar. And he said, if you can help as many people as possible get what they want, you can get anything that you want.
Yeah.
I think the other way around. You can get anything you want as long as you help enough other people get what they want.
Yeah, it's better to help 1 million people and only take 1% or maybe 0.1% of the changes that you have
and
made.
That will be enough.
Yeah. Then comparing to you help 1,000 people and take 10% of every person. Yeah.
Absolutely, that's how the scale works. Yeah. So in your growth from employee dentist, one single dentist, to a large group director, so what do you think are the most significant factor that contributed to the whole success?
I think in my company, because we wanted to address the regional lack of service problem, so we will have to actually, A, we have to control the cost, and B, we have to improve our provider's service and our provider's ability, right? Because it's hard to attract successful, already established providers, dentists, to the regional area, because you're gonna ask a question, why the hell they want to go, right? So you have to actually train your own person to be able to deliver that process, that service to the regional areas. So that's why we put an enormous emphasis on mentorship. We put an enormous exercise on how do you educate our providers to be able to provide a up-to-date modern service to the society. And that is actually done through the academy. So we have a Origin Dental Academy that trains the dentists, bringing the digital facilities to the regional areas. We also have an Origin Dental Supplies, which imports dental consumables and dental equipments at wholesale price directly from the manufacturer. That is important because when we acquire those regional practices, they are usually not very well equipped. They usually have outdated equipment, some of which is not even computerized in terms of records. They're still using the bars for doing their x-ray, and some of them not even complying with infection control standards. So we will have to actually bring a change. So in order to bring that change, it means a lot of capital investment. And the only way to decrease that cost is through scale. So we go direct to manufacturer, we buy things at scale, so that enables us to decrease the cost, and also through the academy, through a management system that's already established, we can then train the person who can then utilize that service in the regional areas.
So basically, to have a system make the recreation or duplication of your head office to different rural areas, and train the person to be as high quality as yourself to serve the community in the rural areas where not many supplies. Okay, that's fantastic. And then that's very similar to us. We have a Hippo Academy. We work with a lot of education institutions. Like this year, we work with UNSW and become their business mentor and help the youngsters, students graduate to get trained, to get educated with the real world problem solving, and help people to get a realistic approach to their wealth management. So, but I think you're also tap into the supplies of your equipment so that you can negotiate the price to make it affordable. And once it's affordable, then it's feasible to actually open a new dentist. And that's why you have gone so many to now 30 something. Is that right?
Yeah, that's right. So through scale, I think we on average, we can decrease about 30% of the cost.
And that from 2017 until now, that's only 7 years. And you have grown to over 34. That's like how many? 5 per year?
Yeah, something like that.
That's quite that's extremely like unbelievable. Very impressive. So do you have a target in the future? How many you want to scale to, or is there a mathematical formula that you use to
not really,
grow?
because so first of all, not all the clinic is directly owned by us, so we have partnerships, of course, because dental practice is at the end of the day a service discipline, a service professional. So by service, you need people on the ground to do the job. You can't just have a dental chair sitting there drill its own teeth. Well, that might happen in the future. Actually, not very far future. That might happen, but at least now we need people on the ground. So when we need people on the ground, I would need capable dentists to become partners, and they will in turn, service the local community that way. So we've grown through partnerships. I think from the moment that we have about 12 clinics, we established a partnership model with the dentist, and at the same time, we enable them to deliver service to the local people. We provide a platform for their career growth. So through our platform, what the partners can get is that they can grow at a much faster pace than they would have otherwise by themselves.
So would these partners from your employee, or you actually seek external dentists?
All the partners, we have a rule, all the partners will have to be from not employee. All the dentists are on agreements.
In your agreement, okay.
So the dentists are not employees, the dentists are service providers in the clinic. So the logic is that the dentist will provide service to the patients, and then the patient pays the dentist, and the dentist then pays the clinic a fee for using the clinic service.
Subcontractor agreement.
Yeah. So all of the dentists have to be working in our clinic for a period of time.
Right.
And we assess the partners based on A, their clinical skill, and B, their interpersonal skill, and C, their main goal has to align with what we're doing. So in other words, their treatment philosophy, their philosophy as a person will have to fit in the team.
Fantastic. And it's very hard in Australia to find the right people to work with.
So I guess that's one of our challenges as well, to find the right partner. We are different from other dental corporates or dental corporates funded by funds in Australia, such as I won't say such as who, but so we're different from that, because we don't just go and buy clinics and just install partners, that's whoever. We select partners very, very rigidly and very, very carefully. So one of the challenges is to get enough partners on board, I guess, because each partner will have a ceiling that they can expand up to, and then they lose the personal connection to the clinics.
So with the partnership model that you expanded through duplicate and then scale and then partnership and then have equity arrangements, so you have to have enough value to provide for the partner willing to give up on themselves and then working with you. You mentioned by working with you, you can speed fasten their growth. Have you calculated how fast, or in terms of their income, or in terms of their equity?
I'll give you an example. Like one of the partners that we have in Tasmania, he started working with me when he first graduates. So after 2 years, after a year, we sent him to Tasmania. So he started in Narrabri, which is a regional New South Wales town, and then after a year, we think he's pretty good. Then we sent him to Tasmania to start a little cluster of himself, and then later on, after 2 years, that cluster expanded to 3 clinics
in Tasmania.
In Tasmania, and today he has 5 clinics.
Wow!
So he's only, I think he's 4 or 5 years post graduation to my memory. No, sorry, more than that. Probably 6 years post graduation.
6 years post graduation and had ownership in 5 clinics.
He has 5 clinics already. So whereas on average 6 years post graduation, a dentist, like a good capable dentist, will probably have 1 or 2 clinics.
Oh,
yeah.
That's like more than double.
It's more than
that.
double this. Well, as I said, for any business to be successful, you got to be win-win. You can't. And I always say 1 + 1 needs to be equal to greater than 2.
Yes.
If 1 + 1 = 2, then there's no point. Why do they need to partner with me?
Yes.
If their growth only double, it has to be more than double.
Yeah, you have to make an offer that they cannot refuse, an offer that they wouldn't have achieved without your help.
Yeah, because one of the a special thing about dentistry is that the dentist is going to have to be a scientist, an engineer, and an artist, and a businessman at the same time.
And psychology maybe.
Yeah, and maybe psychology, dealing with patients and talking, right?
Yeah.
So scientist, because dentist is based on science. Artist, because dentist is very, very aesthetic driven. How your teeth look like, how the white in different shades, that can really affect your treatment outcome. Engineer, because we're dealing with missing teeth, we have to cantilever, we have to deal with fake teeth. How do you install that fake teeth stable so that it can withstand all the bite force? That's biomechanics. And then you have to be a businessman, because you've got to have your own surgery. There's not many dentists that work under a organization for the rest of his life. Usually the progression goes, you graduate, you become an employee, you're an associate dentist, then you're a clinic owner, right? Because in Australia, like when you knock on a person's door, an average dental practice is 2 to 3 chairs. It's only usually about 2 to 3 dentists working inside, owned by one dentist. That's how usually the models work. So all the dentists will have a dream. Now, dental school only teaches you the science. It doesn't teach you the art.
No.
It teaches you a little bit about engineering and biomechanics.
Yeah.
All right. Art lacks. So whatever you have the artistic eye, that's up to you. So dental school only teaches us how to fix the teeth, so it's solid and doesn't fall out. It doesn't teach us how to actually do a beautiful tooth, okay? And then dental school don't tell you how to open a practice.
No.
So when a dentist comes out, they have zero idea of how finance and everything works.
Sure.
And that's
taught in business school.
Yeah, that's taught in business school. But I mean, at the moment that you wanted to set up a practice, then that's what you have to deal with. You got to pay tax, you got to pay your employee, you got to pay, this and that. There's so many rules around what you have to do to make it viable. So I think that's where our expertise comes in. So we resolve that finance issue through partnership. So we have a head office. The head office provides accounting, provides IT,
management system,
marketing, management. We also help you to tutor you how to do HR, how to talk to your employee, how to deal with good employee, when you need to reward your new employee, when you need to actually let someone go if you can't change the behavior. All of that. That's our head office service.
Yeah. So that if you do it on your own, costs more because you are small, starting. If you start
it's either going to cost you a lot of money, because then you have to find a marketing firm, you have to find an IT firm, you have to find a different firms to do all this, or it's going to cost you on actual figures, because then you try to do it yourself and find out that you can't do it.
And also the time involved
to
figure out what works, what not works.
Yeah.
That's fantastic. I think your approach has proven to work, and also has created value, not just win-win for you, for your partner, also for the rural area patients, so they have the access to the service. In terms of your mindset, in terms of your philosophy, so what role has your mindset play in the whole journey? Have you always have a personal growth mindset and regular routine that helps you maintain that
that's
behavior?
A good question. In my spare time, because when I first started working rural, when I graduate, I started working in a town called Warracknabeal, and that town is 3.5 hours drive from Melbourne. And I had a girlfriend back then, so I drive to the town and back every single week. So every single week I drive 3.5 hours to and 3.5 hours back. And what do I do in that 3.5 hours? I like to listen to podcasts. And I think that's one of it's almost like reading a book, but in an audio form.
Book,
I find listening to music makes me fall asleep. So then I listen to the podcast. I find that keep me awake.
Yeah, who's your favorite podcast?
I don't listen to a lot of role models and success stories, but what I like to listen to is history.
History.
Yeah, I really like Chinese history.
Wow.
So I listen to those history person talk about history. Right now I was listening to the 战国.
Okay, like an ancient kingdom expanding.
I don't know if the audience are familiar. In the Qing dynasty, that's the first dynasty that unified China. And before Qing dynasty, there's a lot of different countries. China is really fragmented into small countries, so people fight each other.
Yeah.
And there's a really like a big fight, right? And then in that big fight, you can see how people react to different situations. And I think that really taught me of how to run my business and how to deal with people. I think that's one of the biggest things that I lack as well, because I am always by myself. Like I don't like to go to parties and interact with people. And in business, I have to interact with people. So I know my weakness is in people interaction.
So you think you are more introvert?
Yeah, definitely. You know that 16 personality test? Yeah, I'm INTJ.
INTJ.
Yeah,
what does that?
Introvert.
What does that stand for?
So actually, I don't know.
I only know introvert.
I only know introvert.
Or extrovert.
Yeah. But INTJ is an architect. It's like I tend to think things in logic.
Yeah.
I want to maximize efficiency.
Yeah.
But I find a lot of the times, efficiency and reality doesn't match up. Like for example, I'll give you a perfect example. When we are married as a Chinese couple, we have kids, right? And usually the cheapest way is to get your in-laws to come and help. Or get my mom to come and help, or get her mom to come and help, right? Because you don't have to pay them.
Yeah.
But then that's actually the most expensive way for me, because they fight. And then I have to take time off to resolve the fight.
That's true.
So
your mom come fight or her mom come fight?
Both.
Both fight. But don't let both of them come.
No. So the solution for me is that I don't get any of them to actually come and
just hire one.
Yeah, I just hire a nanny, and the nanny will do the things, and then my mom only comes in and play with the kid. So she has no responsibility, right? Same as my in-law, no responsibility. So that way I find, although it's not maximum efficiency, but then
so you have less trouble, less stress to deal with. And which that is most valuable when you actually deal with business. That you need to always stay positive, stay motivated, inspired to actually solve the problem every day for the partnership, for the patients and the employee.
Yeah, maybe you edit that bit a little bit, just not to make my wife unhappy.
That means you takes wisdom, mindset, the right mindset to solve problem in a wise, cheapest, efficient way.
Yeah, I think if you ask me what I value the most, I think knowing yourself. Yeah. You have to know yourself, know what your strength is, know your weaknesses is, and then after knowing your pluses and minus, then the question becomes: do you work on your plus or your minus?
Yeah, of course.
I have the philosophy that I work on my plus, but I will only work on my minus to be just enough so that the minus doesn't drag me down. And then I don't work on the minus at all, if that makes sense.
Yeah, of course.
So, for example, in my own personal journey, I'm an introvert. I don't like talking to people, but I have to talk to people. Yeah. So I have to work on my interpersonal skills to be just enough so that they'll get me through the everyday life. Right? And I know I can't become expert in this. So that's why I have a business partner, Jeffrey Liu. So he takes care of all the operational headaches for me. And he's really good at this. I will never be as good as him in staff management, in client management, in socializing and bringing the image of the company. But I'm really good at my academic side of things, like technical things. So I know how to manage dentists. In order to manage dentists, you have to be better than them. Yes. You have to be the best dentist or a good dentist for yourself. So that's what I did. So at the same time, I manage a company. I also focus on my own professional growth. Yeah. And I work on my ability to talk to the patients. I work on what it takes to be a good dentist. so I can then teach those to my colleagues.
Yes,
I guess.
yes. That relates to a topic that I'm going to ask you is about leadership. In order to become a leader in a business, people have to trust you, believe in you, follow you. And if you're not as good as them or even better than them and give them more directions and guidance and teach them and share them things that they don't know, why would they follow you?
Yeah,
so
that's right.
So is that right? That's how you become when you're a leader, people are more likely to follow you if you can help them grow.
I guess that's pretty much all the people in my personality group. So all the dentists falls, well, pretty much majority of the dentists falls in my personality group. Like we are all very similar.
All similar.
We're all very
all
similar.
introvert.
Yeah.
So you guys in the same room, they don't. You guys don't talk.
We guys only talk about tooth, right?
Okay.
So when you have dinner, I don't know when you have if you guys had that experience. When you have dinner with a dentist, they do shut up. And then when dentists have a dinner with dentists, they only talk about teeth.
I did join some of your annual conventions.
Yeah.
They're quite positive. I think quite outgoing. Some of them are happy, giggling.
Yeah, but all the dentists, like how do I put this? Like when you face a problem, when you work and you see a problem, right? My first instinct is I need to tackle this problem. So my first instinct is I'm going to go on Google, ChatGPT, before it's books or whatever. I need to learn why there's a problem.
Yeah.
I need to learn A, B, C, D, E. Okay. I need to have a solution 1, 2, 3, 4, 5.
Yeah.
And then I need to implement that solution to resolve the problem. That's a very scientific way of thinking it.
Yes.
And that's what it takes to be a good dentist. You have to be like this.
Yes.
Okay. Whereas in business it's different. You can't be like there's a problem 1, 2, 3, 4, 5. You figure out a way and then you solve it because you are never by yourself.
Yeah.
Business is always a team. So you have to. What you have to do as a business leader is you have to select the right person to tackle that problem for you. Not that yourself is going to tackle every single problem. Yeah. Otherwise you can't grow big. I think a lot of dentists when they start a clinic, they have an IT problem and they're trying to become an IT professional.
Yeah.
Their chair breaks down, they're trying to become a technician.
Yeah.
They have a marketing problem or they will try to become a marketing professional. Even when the dentist hires a marketing professional for them to do their website, they wanted to know exactly what this person is doing. Yeah. So that way it's called micromanagement. Yeah. And usually, you leave the capable you leave it in the capable professional's hands.
Yes.
And you take your hands off it.
Yeah. Otherwise, you just get tied up in all the details.
That's right.
And Alibaba's founder of Alibaba, Jack Ma, said he doesn't know how to use computer. Yeah. And he's creating one of the largest e-commerce.
A very good example, and I'll go back to my podcast, and this is why I listen to history. Is I don't know if you guys know about Liu Bang and Xiang Yu in the Qing Dynasty I was talking about, right? Xiang Yu is a person who's really good at fight. Yeah. Right. There's a fight between Chu Han. Yeah. Liu Bang is the Han, and Xiang Yu is the Chu. Yeah. When they fight, Xiang Yu never lose. Individual fight, wherever Xiang Yu is, he's gonna beat that person. Yeah. Right. Always. Yeah. But Liu Bang, where Liu Bang has a battle, he run. He always fail. Yeah. Yeah. But in the end, why Liu Bang wins? Yeah. Because he can put the right person in the correct use. And Xiang Yu is always by himself. Yeah. That's the main difference.
I think that's a problem that everyone is faced. Is are you going to be a specialist or a leadership, a generalist? You don't want to stuck in one area.
Yeah, but I guess being a specialist is good. I'm not saying it's bad, but like for example, take back like Xiang Yu. Yeah, he is much better to be working under someone. Yeah, rather than by himself. Yeah, because once you work by yourself, you have to put the right person in the correct shoe. Like like what I'm saying is Xiang Yu is not a great leader. Yeah, but he's a very good general. Okay, but when you're a very good general and you try to be a leader, then it's not going to work. Yeah. Yeah.
So it's not positioning. It's both positioning yourself in the right direction, in the right truth. Yeah. And also positioning other people in the right place.
So you have to know what you're capable of, what your advantage is, what your disadvantage is. Yeah. Then you don't allow your disadvantage to actually hinder you. Yeah. And at the same time, you want to grow in the things that you're able and capable to do.
I think this is very, very important. This is what we call in our professional risk management. So we talk about wealth management, wealth creation, and wealth protection. So investment is like you get the money growth up for you, but on the other hand, you want to manage the risk in the event of something happen or something you're not good at. You want to protect it. Like in the old time, when they fight, they always build a river in the front of the castle. So in your business journey or in your personal wealth journey, how do you think the risk management play in protecting your business and protecting your wealth? You talk about the personality, but also in terms of business, how would you approach it? So
well, I think risk management is an important thing, of course, like running a dental practice, right? Every dentist is insured, every dentist has indemnity insurance. So from a professional point of view, we have to manage our relationship with the patients. So we have to buy what's called a professional indemnity insurance. So if something goes wrong, then that insurance will cover you to resolve the issue, right? But of course, you manage it from the beginning, so you don't allow something goes wrong. Then,
of course.
Which is you have to have an established system of diagnosis that comes down to a clinical skill, whether you can actually deliver the treatment, right? And then it comes down to your organization skill. Do you have a standard operating procedure that you go through for every single consultation? Every single patient will have to receive the same information, sign the same consent form, go through the same process, because that's very important. Because we see, I see, when I work, I see 10 patients, 15 patients a day, and there's no, if I don't have a standard operating procedure, I can't be sure that I don't miss something. So that needs to be done in the right way. And actually, dental school don't teach you that. Dental school will teach you what's required, but it doesn't teach you how do you implement, how do you make sure everybody gets what's required. So that needs a system which we will provide that. So we will have standardized consent forms, standardized PowerPoint presentation for consultations. We have a process by which the nurse will give the patient some information prior to the visit to the dentist, and the dentist has checklists that we'll have to go through in terms of consents, clinical stuff like that. Also, of course, talking about personal side, I do have an insurance for myself. If I die,
income protection, life insurance.
If I die, I don't leave a whole bunch of loans to my kids and family. I think that's a responsible thing to do. And also, I guess at any given stage, because when you run a business, you take on debt, right?
Of course.
You have
financial obligations.
You have to make sure that your debt is
paid off.
No, it's not paid off, but you have to make sure your debt is sustainable. You have the way to pay it off. And for every dollar that you borrow, you need to make sure that it produces $2 of value or more. Because if you borrow $1 and produce $1 of value, then you're netting zero. You're not actually
making a loss.
That's right.
That's very important because we specialize in insurance, and we totally we work very closely with professionals like you and business people and entrepreneur and specialist medical professional. And risk management is often somewhere we ignore. Even with personal growth, business, we often ignore the blind spot. And often it's the blind spot that actually caused the big failure. So I think when you grow large, the blind spot may get more, and there are more things you need to look after, more things you need to prevent from happening. And what's your plan for the future in your Experteeth Group? Because from beginning, it's one person, now it's so many people, so many employees, so many branches across Australia. So what would be your primary focus in the next, say, 5 years?
So in the past 10 years, I've been focusing on my personal growth, right? So I was doing my implant specialist training, attended a master course. I was focusing on how to become a really good dentist. I've graduated from the American Board of Implantology now, so I can't call myself a specialist in Australia in implants because there's no such specialty, but I can do so in America. So I guess the next step for me is I'm taking actually the step back from clinical. I'm actually cutting myself in when I'm seeing patients, precisely because of the reason I mentioned before. I can only help so many people by seeing patients myself, right? So I need to train more dentists. So I'm more focusing on the management side, I'm more focusing on the training side. So in the dentist side, I'm running the academy. So we are actually diversifying the courses into specialties. So we're teaching implants, we're teaching ortho, we're teaching digital dentistry, those specialized stuff in dentistry that enables them to grow. So we're working on that. And also in the management side, we just need to have a system where we can replicate capable people, because we find dental practice is a very niche field in public. There's not many dental practices around. So therefore, finding a capable dental receptionist or finding a capable dental assistant is much harder than finding a capable nurse. These two are different. The dental nurse is actually not nurse. They call dental assistant. They require a whole set of different knowledge than nurse. So a nurse can't just rock up to work in a dental practice because they haven't got the training. So then we need to find out a way to train these people because it's hard to get them from outset. So and we in our regional practices, pretty much 100% of our support staff, meaning reception, nurses, DAs, they're actually from local. So we train them from local. Because that provides So
you start the recruiting process when you trying to
we recruit. No, we acquire. So usually we don't open new branches. We acquire the branches from existing practices that's finding it difficult to recruit staff. And the owners generally just have enough, because recruitment and persons, and whether it be DA or dentist, is one of the major obstacles in regional practices. So we just need to resolve that to be able to run it, right? Because otherwise we're going to face the same problem. So I need to resolve the issue of dentists, and we need to resolve the issue of the support staff, and we just need to do it better. So it enables us a bigger scale.
And you hire from the local?
For support staff, we hire from the local. For dentists, it's not possible to hire from the local.
And then that grow from your Experteeth Dental Academy and your existing dentist partner.
So for dentists, we have to hire from the general public. Usually we hire young dentists that's willing to grow on their career. As I said, these people are not established in metro areas. They often don't have a family, they're by themselves. So it's easy to get them to move to regional. If you have a husband or wife and 3 kids, it's probably very hard for you to move out of Sydney.
That's also, if you want to start business or entrepreneur, start early, because otherwise if you have children, family, you have too many responsibilities.
That's right.
You don't want to lose and you're stuck with your day job. Last thing, not least, in the history of dental Experteeth Dental Group, you have made multiple charitable contributions, such as donating masks during the pandemic. Can you share more about the importance of giving back to the community in your company philosophy?
So during COVID, because we run a supply company, and one of the major supply to dental practice is gloves and masks. That's what we use. We use a lot of gloves and masks, much more than GP practices. So we actually have a whole pile of stock of masks at the time of COVID.
Wow.
So at the time of COVID, when it hits, mask price went through the roof.
Yes.
It went from $10 a pack to $1 per mask.
To $50 I think. And so, even that you can't buy, you can't get one.
There's no stock. So what we did is that our mask, we did not increase the price throughout the whole pandemic. But of course, we didn't do advertisement and try to get people to buy from us. But if you come to our dental practice, we have a sign at the front. We have masks available at $7.99. $7.99 per box of 50.
Wow.
So that's less than, I don't know, you can do your math. That's pre-pandemic price, and we offer it to the general public throughout the whole pandemic. So that's non-stop.
Have you ever run out during the pandemic?
We have so many.
Wow.
Yeah, we have so many. And I mean,
you should have done some advertisement.
Then our stock will actually run out. So but a lot of our patients, they come to us, they buy.
Yeah.
So that's something that we did. We also have charity days in local communities.
Yeah.
So one of the events that we did is we have what's called a day of giving back.
Yeah.
So we have the nurses and the dentists, they work for free for that day. So nurses, they donate all of their salary. Dentists, they donate all of their salary or taking on that day. And the patients coming, they will get 80%. They will get 20% off for treatment fee. They pay the normal treatment fee less 20%. So that fee will all go to the community. And we as a company, as the service organization, we will match that total donation. So if we run a day like this, typically we can raise over $10,000, and then we just give it to a local charity group. We did it once for when Narrabri has a drought. There's a very big drought event before, I think in 2018.
Yeah.
We did that. We also have the educational sessions. Like one of the event that we run is called Little Dentist Experience. So
for the kids?
Yeah, for the kids. We have primary school students, they come in, we team them up, one be the dentist, one be the patients, and then we invented like a little comparison study for when you use an electric brush and the manual brush.
Wow.
So this way they get to experience...
Which one better, by the way?
Electric brush.
Yeah, I use the electric one.
So this way it gives the comparison of what it feels like to be a dentist, a little job experience, and teaches the kids about scientific way, how do you design an experiment, and also raise their oral health awareness. So I think it's a great event.
It's very good for the community, for the charity, for the kids, for the next generation to build a healthy lifestyle, healthy, oral health. It's very important. Because of all these virus, all the bad habit, sugar, that cause a lot of damage to our health. I think it's always best to promote, advocate healthy lifestyle, also to help people in the rural area, people with disability, people with vulnerable people. I think that's...
And also, I'm not sure if the audience are familiar about the concept of water fluoridization. So in Sydney or established metropolitan areas, our water is fluoridated. So we put fluoride into water. And that is actually a very significant contributor to the fight of caries, fight of dental tooth decay. So that's why you don't see as much tooth decay now as compared to say 20 years ago. Part of the reason is because the water is fluoridated. But there is a lot of negative voice about it, health concerns, but as a dentist, we don't believe in first of all, there's no scientific evidence to say there's any negativity in water fluoridization. So as a dentist, as a dental organization, that's what the ADA, the Australian Dental Association, advocates as well. Water fluoridation has only benefit but no risk, and very minimal risk, and it's something that we should do. In regional areas, I just find out because I open a lot of practices in regional. In regional New South Wales, there's a lot of towns that actually don't have water fluoridization. So we actually go to the newspaper and we raise that awareness to the community. I believe one of the towns is already fluoridated because of that.
Oh, okay, fantastic. So it should be done by the local council?
Yeah, it's done by I'm not sure it's done by the local council, but it's done by the Sydney Water. Or the water supply side of the government organization.
And that indirectly helps more people, even not your clients, not your patient, they still get benefit from it. I think that's what I've learned from Dr. Hong Chang's journey, that started with a little burning desire for a big vision to serve more people in the community, and with the right technical skills, processes, right people, right mindset, and also the right risk management philosophy, he has managed to grow from one chair to over 34 clinics, and that's still in the progress. And we definitely hope to see your bigger success in the future.
Thank you.
And we hope that your philosophy and your value can extend to many, many more people in our society, and have health in their life, and have a good oral health and oral knowledge education through your dental academy, and replicate more good quality, good specialized dentists just like yourself in more rural areas, so that more people can get the benefit. Thank you very much for your time.
Thank you, Jeff.
And I hope today's episode can give a really in-depth idea of how we can build a great company, how we can create great riches for the community. Not just money, but also health, also people's well-being, also your personal growth. So thank you everyone for your time, and I hope to see you next time. Thank you.
Thank you.